Cryo-immune vaccination is a new approach to the treatment of metastatic cancers. It relies on two steps. The first, to freeze a portion of a tumor in the patient to release antigens and provide an inflammatory stimulus. And the second, to infuse that treated tumor with a combination of immunotherapies that can help change the attitude of the immune system to the tumor to create a productive immune response in the patient. So the pioneer in this area, Jason Williams, had originally conceived of the combination therapy of using a device, cryotherapy, with the combination local regional immunotherapy. And in our work, we have modeled this preclinically in an animal so that we can begin to understand the principles by which this seems to produce a productive anti-tumor response. And what we have found so far is that we can produce a similar effect that one can see in clinic, and that we believe that some of the process involves suppression of an enzyme known to block the immune system that tumors use, called IDO1. So getting rid of IDO1 activity seems to be important in making this process work in an animal. The clinical data are compelling insofar as a number of patients have been tested in the phase 1 trial of this therapy. The specific therapy is called SYNC-T therapy that's been organized by the company Synchromune, Incorporating, with whom our institute is collaborating. And those responses in clinic suggest that this kind of a combined approach can produce an anti-metastatic effect in patients, even to the point of clearing disease completely in some patients. The safety in the phase 1, of course, was a concern. But one of the benefits of this approach is that you avoid the toxicity of systemic immunotherapy because you're only treating local regionally. You generate antigens in the vaccine naturally, the body chooses, so you don't have to find out what the best antigens are for presentation to T cells. The cryotherapy selects those, and in multiple cycles, as you treat different metastases in the patient, they get exposed to different rounds of lesion-specific antigen waves that inform the immune system at different stages of the cycle. So that by 2 to 4 cycles, most patients are having a productive response where they're attacking their metastases distally to the treatment that was given locally.